Major funding for Immortality Now was provided through an educational grant from Hotze Vitamins. Founded in 1993 by Dr. Stephen F. Hotze, Hotze Vitamins is committed to delivering only the finest quality vitamins and supplements to meet your patient's needs. Now offering customized vitamin packs, Hotze Vitamins is making it easier than ever for your patients to get well naturally. For more information, visit client.hotzevitamins.com.
Hello, I'm Dr. Ron Klatz with the American Academy of Anti-Aging Medicine, and this is Immortality Now. We're filming in Las Vegas, and my guest is Dr. Gallagher from Pennsylvania?
Yes, right outside Pittsburgh.
Outside Pittsburgh, okay. And Dr. Gallagher has a very unique and a diverse education in many areas of healthcare, preventive medicine, anti-aging medicine, functional medicine, infectious disease, and perhaps you could tell our viewers a little bit about your background.
Sure. Well, actually, I'm uniquely triple licensed. I'm a board-certified family physician. I'm also a chiropractor and a medical acupuncturist. I have a master's degree in nutrition, and I teach at two medical schools, West Virginia University School of Medicine, Department of Family Medicine, and interestingly, Dr. Klatz, I think this is very germane to those listening. We started a medical acupuncture program at West Virginia University, Department of Family Medicine, and isn't it unique that family doctors are graduating from the program as board-certified family medicine and also board-certified in medical acupuncture? So they go out and launch their careers as family doctors that can think out of both sides of their brain. I think that's quite significant. And so in my practice, of which we're in a 25,000 square foot facility called Medical Wellness Associates, and we have 42 employees, medical doctors, chiropractors, colon hydrotherapists, intravenous nutritional therapists. We practice true integrative medicine. So even though I'm boarded in family medicine, we veer away from the conventional medical approach because the type of integrative medicine that we use, which includes manipulation, acupuncture, bioidentical hormone replacement therapy, intravenous nutritional therapy, ozone therapy, has such a profound effect on improving a patient's health that the need for medication and the requirement for surgery drops dramatically. And so we're very much into treating full families with this holistic integrative medicine concept, and it's remarkable. So I think the membership really needs to know about it.
Now, in your part of the country, in Pennsylvania, the issue of Lyme disease is really coming to the fore. And I find it very interesting that just 6 months ago, the CDC came forward and quite uniquely, and I suppose in a way to their credit, they admitted that for years and years and years and years they've been underestimating, or some people think kind of lowballing, the prevalence of Lyme disease. And instead of there being 30,000 cases of Lyme disease in the United States, the actual number is much closer to 250,000, and some people are suggesting well over 300,000 cases of Lyme disease in the United States. Now, you see that in your practice.
Very extensively. Actually, in Western Pennsylvania, Lyme is endemic in the current stages. And also, there's a number of people that have diagnoses like fibromyalgia, chronic fatigue syndrome, autoimmune forms of arthritis, and quite frankly, the basis of that is Lyme, or a better term perhaps is Lyme syndrome. Yes, they have Lyme, but they also are co-infected with Bartonella. They're co-infected with fungal infections, with mycobacteria. And so patients in turn, here's the options. Are you going to do 2 to 3 years of antibiotic therapy and create fungal infections? Or recognize that...
But the CDC says you only need 30 days of antibiotics.
I would agree with that when you talk about bacterial infection, which Lyme is certainly a bacterial infection. So for the first 30 days, there might be a justification for using antibiotics. On the other hand, once you go past 30, 40, 60 days, you're in the world of autoimmune disease. And so when it switches into an autoimmune problem, continually giving people oral or intravenous antibiotics is completely counterintuitive. The more logical thing is to say, okay, in this milieu of this patient that has chronic fatigue syndrome, fibromyalgia, multiple chemical sensitivity, electrosmog toxicity, how is it that we can start rejuvenating their body? And so we take the approach, first of all, of structure and function, which is a basic premise in osteopathic medicine and chiropractic medicine, that the body has to be structurally aligned. And so this is the role of chiropractic osteopathic manipulation, to in turn turn the body onto its natural healing capacity, its innate capacity to heal.
How are you making diagnosis of Lyme's infection? I know you can make the diagnosis of the syndrome based on the symptomology, but on the parasite itself, what are you using to make that diagnosis?
So our analysis currently involves using laboratory tests, but we also recognize that when we do lab tests, whether it's IGeneX or LabCorp, that there's a limitation to that. You can do live blood cell analysis as another method that is worthwhile considering. But if you go to the CDC website and they talk about Lyme, they'll say that there's no one single test that indicates that people have Lyme or Lyme syndrome. And in addition to that, we also know that you can have Lyme by the signs and symptoms of it. So there's a lot of people that have rheumatoid arthritis, what appears to be collagen vascular disease, chronic fatigue syndrome, fibromyalgia, or just you can't put it into a category, but it's malfunction. Oftentimes the basis of that is chronic interrelated bacterial infections, fungal infections, and the inability to detoxify. That's an overriding problem.
And how are you using rather innovative therapies for this quasi-infectious condition? Things such as intravenous curcumin and intravenous silver, ozone therapies.
Yes.
Perhaps you could explain the benefits of these different therapies and how they're applied.
Yeah, so if you have a patient, for instance, that's infected, and a lot of patients today have brain fog, chronic fatigue syndrome, muscle aching, digestive problems, an entire milieu of signs and symptoms, you need to think in terms of chronic low-grade infections, even without fever, right? Fever or chills. So one of the key things that we do is we start them with intravenous ozone therapy. So ozone is actually done extracorporally. The blood is drawn, it's into a sterile bag, and then ozonated, and then it's dripped back into the person's system. We follow that with high doses of intravenous vitamin C, which we all know that when vitamin C is taken orally, it's an antioxidant. When it's taken intravenously, particularly at higher doses, which can be 25,000 to 125,000 milligrams in a single setting, it switches from being an antioxidant to an oxidative therapy. The body's producing hydrogen peroxide extracellular. With ozone, it produces it intracellular. We follow that with intravenous silver. This is all in the same session. And then we also use other forms of therapy like hyperbaric oxygen therapy, intrarectal ozone therapy, and as well as the nutritional therapies that I was speaking about, which is PO vitamins that people are taking.
How about UV light?
Yes. Well, the UV lights that we're using currently, we're using a more sophisticated form of that. I attended the European Ozone Conference. The Europeans have developed, particularly in Germany, the use of cold lasers, right? And so we know that if you apply a cold laser to someone's skin for pain modulation, that can be moderately effective. The reason some people don't favorably respond is because about 85% of the light is deflected by the skin. And particularly if you're black, you're not going to get really any therapeutic benefit. So the Germans began researching this and decided, well, perhaps if we put the cold lasers below the skin, interstitial, we put the lasers in specific wavelength lasers intravenously. If we use the lasers intra-articular inside the joint, is there a greater therapeutic effect? And if we precede that with a photosensitizer, such as intravenous hypericin, the use of intravenous curcumin, the use of intravenous forms of chlorine, is there a greater therapeutic effect? And the answer to that is yes. I believe that this is actually going to be the new form of chemotherapy as we move ahead. It has anti-cancer properties, antiviral properties, antibacterial properties, and has a direct anti-inflammatory effect on the human body. So we pre-treat the patients with the intravenous plant extracts that are purified specifically for that. They are photoreceptors, so they're picked up by unhealthy cells and tumors. And then we treat them with intravenous lasers, along with lasers that we use externally. And this is well documented in the medical literature. So this is another of the components that we use within our practice.
Where do you think that the therapies are moving right now with regard to infectious disease? I mean, we're finding out that more and more organisms are immune to traditional antibiotics. We're finding more and more problems with dysbiosis and gut problems and leaky gut and all sorts of chronic GI problems and immune problems associated with the use of long-term antibiotics. What do you think the future of antibiotic therapy holds, and what sort of natural antibiotic therapies are you finding effective?
Well, first of all, I practice integrative medicine, and I rarely use an antibiotic. For some Lyme patients in the first 30 days, I'll use that. For a patient that has pneumonia, I prescribe oral antibiotics. Beyond that, I very rarely use an antibiotic. We all know about resistance. We all know about gut dysbiosis that occurs from that and the creation of SIBO as a consequence of that. And so the strategies that we use...
SIBO? Mm-hmm. For the audience.
Small intestinal bacterial overgrowth. So this is the basis of autoimmune disease, right? So you have a healthy biome in your small intestine with healthy bacteria that we've evolved with genetically over a period of millions of years. And now you take antibiotics orally or eat the American diet, which is laced with antibiotics, and in turn you destroy some of your healthy bacteria. You create fungus as a byproduct of that, and you get bad boys. You get really bad bacteria living in your gut. The consequence of that is 70% of the immune system lives in your small intestine. The majority of serotonin and melatonin are made within your small intestine. So now you have the breakdown of serotonin and melatonin, sleep disturbances, anxiety and panic problems, maldigestion and malabsorption, leaky gut syndrome. So we have to move away from the antibiotic approach and only use those hammers if we have to. Instead, why not 1,000 milligrams of vitamin C every hour? Why not echinacea, golden seal, plant extracts to be taken as teas, tinctures, or oral capsules? So we oftentimes use that combination where we have patients take capsules of that every 2 hours. We use intravenous silver. We drip silver into the system, which has a profound antifungal, antibacterial effect. We have people spray silver in their mouth several times a day, spray it topically on the skin as an anti-infective for the skin. Why not promote detoxification? Don't take anything for your fever. Listen, we're not living within the midst of Africa. The majority of people don't have malaria. Fever is our friend. It's genetically programmed into our system. So we want to promote fever. Drink water. Drink herbal teas.
Until what temperature do you feel, at what temperature do you feel that there's a risk of seizure and someone should be taking antipyretic or a fever-inhibiting medication like Motrin or aspirin or Tylenol?
And so if we're talking about birth to age 1, that group we're certainly concerned about, and we monitor that. Beyond that, quite frankly, I treat patients pediatrics, patients as they age, and elderly people. I treat patients with fever of unknown origin, which is cancer until proven otherwise. What we generally do is we put them on detoxification. We recommend they take no Tylenol, no Motrin, no anti-inflammatory drugs. We have them take vitamin C, echinacea, golden seal, intravenous vitamin C, and we promote sweat. I personally, in almost 40 years of practice, have never found that a fever has been a problem.
Really?
Quite the opposite. Fevers of unknown origin, where patients come out of the hospital with a week or 2 weeks of fevers that are unknown, thinking that they're chronic infections somewhere. We place patients on a 10-day detoxification, 10 days of fruits and vegetables, promote high doses of vitamin C, use milk thistle and things to help to detoxify the liver, consistently breaks the fever, and we tell them not to take any antipyretic.
Interesting. And you never seen a problem with seizures or other disorders?
Never. Now, of course, we have children that come into the practice whose parents report that they've had prior histories of seizures from fever, but we also know fever in kids over the age of 1 that have seizures is not true seizures, right? It's not a permanent injury to the brain, and it doesn't require any form of medical treatment. Those are things that kids just get over. So there's a reason that we have fever genetically programmed in our body.
Dr. Gallagher, one of the most common questions that I receive is about chronic fatigue, brain fog, just people who can't seem to wake up in the morning, who are abusing coffee, drinking 5-6 cups of coffee a day just to stay awake. I know that there is a reason for this, and I am assuming that you have some insight.
I do have insight into it. In fact, I have patients that come in that say that they're drinking 12 cups of coffee a day or more, and their energy level is 3 or 4 on a scale from 0 to 10. So some of the questions I ask, are you tired when you first get up in the morning? And some people say, well, yeah, I'm pretty good when I get up in the morning, but I get fatigue as the day goes on. How do you feel going from sitting to standing? Well, I feel a little bit off. I get a little lightheaded and dizzy. How's your ability? Do you get tired, nervous, shaky, irritable, fatigued, depressed, lightheaded, dizzy, confused, crave sugar, crave salt? When you have patients like this, think in terms of functional hypoadrenia. And I want to underline the functional hypoadrenia, because when you run cortisol levels, they're normal. Now, it might be different if you do a salivary cortisol level, which that's a little bit more reflective. But remember, treat the patient, don't treat the lab. So you can check the blood pressure. The blood pressure, let's say it's 120/80, and you stand up. Well, your blood pressure should go up, systolic, at least 10 points. If your blood pressure is not rising, that's one of the physical exam findings that your adrenal is insufficient, right? You can take a little light, shine it into a person's pupil. The pupil should constrict. If your pupil doesn't constrict and hold the constriction, that's a sign of adrenal insufficiency. So checking the blood pressure sitting to standing or lying down and sitting, going through the orthostatic is an indication. You can also use unique ways. You can do things like applied kinesiology. You can have the patient put their finger on a reflex related to the adrenal kidney, manually muscle test them. You can use dermal screening tests where you're checking for reflex testing associated with acupuncture points related to that. One thing for sure, listen to the patient. They're going to tell you what's wrong. They're tired. They're lightheaded from sitting to standing. They have brain fog. It's difficult for them to cope. They're often under stress. So what can you do? This is functional hypoadrenia. Higher protein, lower carbohydrate, high natural fat diet. Supplement their diet with adrenal extract, pantothenic acid, vitamin C, as well as fats. Make cortisol so you can start making your own cortisol. In some extreme cases, you may have to use bioidentical cortisol that they can take 2.5 to 5 milligrams a day. That can be quite helpful as well. Chiropractic and osteopathic manipulation. Manipulate the upper cervical spine and the mid to lower part of the back. Why? The HPA axis, you'll read about the HPA axis in these adrenal malfunctions. Why can't you physically go in and do something about that axis through manipulation and reinforce it with acupuncture? We certainly do that. And of course, intravenous nutritional therapy. We recommend doing things like Myers cocktails, very important, as well as glutathione and milk thistle. The milk thistle helps to detoxify the liver. The glutathione, of course, is in our DNA. It's our primary antioxidant. So it's important for brain restoration, glandular restoration, detoxification of the gut and liver. I think it's absolutely critical.
That's all very interesting, Dr. Gallagher, and I think that's very helpful, especially since there is so much concern right now with energy levels across the board. But this is, after all, Immortality Now, and I have to ask you the question, what do you think are the 3 most important interventions that you can do today for yourself or that you can recommend for your patients? I'm not talking about diet, exercise, and good night's sleep. I'm talking about, interventions to achieve the potential of that long and happy and healthy lifespan of 90 years of age to perhaps as low as 120 years of age.
So we assume the lifestyle is all straightened out.
Exactly.
That's in place, right?
That's there.
I think the big direction is going to have to be stem cells. I don't think there's any doubt about that. I think it's going to be obtaining stem cells, expanding stem cells, and using stem cells intravenously, intrathecally, finding a variety of ways like, there's interventional radiology for kidney disease and for heart problems, using those same techniques in the conventional medical system to use stem cell therapy. I think stem cells, without a doubt, are going to be the major player in that.
With your understanding right now, what do you think is the most likely candidate for stem cells for rejuvenation, total body rejuvenation? What source?
I believe the best source right now is a combination of fat as well as BMAC.
Bone marrow.
Yeah, bone marrow, a combination of the two. But I think the other part is going to have to be expansion. I know the FDA is against expansion right now, so expansion is going on most of the time outside the U.S. This is something we need to bring into the U.S., gain control of that, find out the most effective ways of doing it, and have that present. I mean, how many people have Parkinson's disease and Alzheimer's and dementia? What are we going to do with these patients, you know? We're not going to solve this by giving them vitamin C or just changing their lifestyle. Those are modifications, but we need some heavy hitters to do this.
I agree with you. And I also agree that stem cells are going to be a big part of rejuvenative medicine in the not too distant future. We're almost there now. Thank you very much. I'm Dr. Ron Klatz for Immortality Now with the American Academy of Anti-Aging Medicine. Live long and well.
Immortality Now is made possible in part by Hotze Vitamins, now offering customized vitamin packs. For more information, visit client.hotzevitamins.com.